sustainable pattern, not with something very crash kind of a thing. Any good professional is not going to recommend you a crash diet, right? Finding time for oneself is difficult. So absolutely right there. That's where
Hello everyone, welcome to this live session. So according to a Lancet study, it has been seen that 35% women die due to heart-related condition. And if we see here in India, around 1.18 million women die due to cardiovascular diseases. And that for hypertension, around 1.69% of hypertension is undiagnosed. This is undiagnosed hypertension, meaning it has not been diagnosed. It can be high blood pressure in women around 15 to 49 years of their age. So let's focus on this word undiagnosed. Why is it being undiagnosed? Because women generally tend to ignore their heart health. They do not, take care of their health. They keep on ignoring it. They keep on delaying their doctor visits, their clinical, their checkups. So most of the time, it has been seen that women are, not focusing that much on their heart health, or rather health for speaking. So that is why BestSource Nutrition, we have chosen this topic to discuss more, and the name of the topic is managing heart health. Is it only a men's problem? Should women really care about their heart health? Should they focus on their heart health? That is why we have chosen this topic, and it's a really important topic for every woman out there. And for that, we have a special guest who is going to join us. Her name is Dietitian Priyanka, and I'm going to...
Thank you so much. Yeah, I'm doing really good.
That's great.
And thank you for inviting me for this. I feel that this topic is really important.
Correct.
And having this female health issues, we are having too much these days.
Yeah, so Dietitian Priyanka, she's a Mumbai-based dietitian. She has a sound experience in the field of nutrition, about 12 years. So I would like to ask Dietitian Priyanka that if we, see that there is breast cancer and there is heart disease, out of these two, according to you, what does women focus on more? What does they fear on more? Is it heart-related condition or breast cancer?
Correct. So Julie, I feel that for a female, both the conditions are equally worrisome. But unfortunately, I feel the women they have a misconception that they will not get any heart diseases. They are very much, worried about the breast cancer. And they are like, maybe it's the awareness which is not that much. So definitely heart health is also equally important. I will not say that the breast cancer awareness is not important, but yes, heart health is equally important. And as the misconception, I say that females have generally this misconception that, okay, hame heart issues nahi hone wale hain, So, but at a certain age, beyond a certain age, you are more likely to fall into this. As you said, logistically also, we have seen that more women die out of this heart-related diseases.
Correct.
Yeah? So yes, so it has to be other way around, but unfortunately, female may pay more attention to the breast cancer as compared to the heart complications, which shouldn't be the case. And equally, they should be worried about both of them. And as I say that it is ignored, so I feel that it should be more taken care of.
Yeah, and why women's risk levels are different that of a men, if we see. Why the risk levels are different?
Yes, definitely, risk levels are different too, and it also it is based on their age group also. So we believe that when they have the start of the reproductive cycle is their starts when the female starts in the early ages, when the puberty just sets in. Yes, then we can say that the risk is lesser as compared to men. But after when you are approaching your menopausal time, when you are above 35, 40 nowadays, because the shift is there in the menopausal time as well now. Earlier, which used to be like above 45 to 50, 55, but now it has got a great shift. So at that point of time, they are more likely to have this as compared to men. So I feel that that is also very unfortunate condition, that why our menopausal time is shifting now. If you have seen the studies, they also say that earlier it was somewhere 51 was the average age of the female to get a menopause. But now it is very worrisome situation where now the women are complaining for menopausal symptoms at the age of 38, 40, 42, very soon. So why this is happening is also a subject of concern, because a lot of stress, a lot of lifestyle modifications, and also I can say it can contribute to the dietary changes what we are not able to cope up with. So a lot of things are contributing to the same. So there is definitely a massive difference between now they are likely to fall into this risk category above 35.
Also, I would like to add in, our lifestyle, the kind of metabolic
Yes.
syndrome that we have. It can be diabetes. Diabetes also can, increase our risk for having a heart-related condition. There is diabetes, and there is, a lot of consumption of alcohol,
Yeah,
smoking. All of
smoking.
these life factors are also, playing a role wherein a woman can have heart-related condition. So
Yeah,
my third
absolutely.
question is, what women should do to protect her heart health?
Yeah, so I feel like women are paying least attention to them. They are definitely a superwoman, but again, I will say that whatever attention they are paying to themselves comes the last. They don't prioritize themselves to the first number, right? They are loaded with so many responsibilities, so many, I can say the things they have to, the deadlines they have to make up in the day. So everything they have to look after, but they are not keeping themselves, they are not taken care of well taken care. So self love is something which I definitely would wish to say that they should be caring about themselves. Second is sleep is something which they are lacking. Every woman is not giving enough importance to the sleep, which I feel is very important. Yeah, they are very reluctant about their sleep. They are like कि, चलो नींद नहीं आए हैं तो कोई बात नहीं, we can still make up in some other time of the day, but still the quality of the sleep is not that much again, right? And you're not able to make up. And then there is hydration. If you take a recall, barely they are having just 2 glasses of water in a day. Yeah, and 2 to 3 glasses, or maybe 4 to 5, not more than that. And again, there is no time for exercise. There's nothing. They feel घर का काम हो गया. That is more than that. Exercise हमारा उसी में ही हो जाता है. So certain points they can always take care of. They can take, and also they can go for a regular parameters checked up. Periodical checkups are very important, which they are again females are not looking after. So like blood pressure or diabetes or the blood sugar levels and waist to hip ratio, wherein we can find out if they have the higher BMIs, right? So all these tests they can go for. They can go for a magnesium check for the magnesium deficiency if they're having. They can go for this vitamin D levels checked. Right. On these checkups, they can get it done. The parameters they can get it checked for themselves. And if they really wish to work on their lifestyle, which is lacking a lot, they can look after everyone else in the family. But when it comes to them, it is the last number they give to themselves. So that is one thing which I really believe that a female should, when a female wants to run a healthy family, the first and the most important thing they should keep in mind is that they should be healthy enough to do so, which they are
Correct.
ignoring a lot. And also somewhere they are shy also to to open up and discuss their issues. They're like ठीक है, and they keep on ignoring, neglecting the stuff, as you rightly mentioned in the starting when you said ki, they are not going to the doctors to discuss their issues.
Yeah.
And yeah, right. And what happens if the child is having little fever also, they will rush to the doctor.
Yes.
And if it comes to them, it's like howsoever ever they are in pain, they will keep pushing till the time they are not getting enough pain to just go and visit a doctor. So we should not wait for that period to come in. We should have periodical checkups now.
Correct. So which food and supplements should women take for their heart health?
Yeah, so Jimmy, there's a number of food supplements and food which they can incorporate in their lifestyle for the good heart health. First, we need to look after how much we can make up to the normal, organic stuff or the natural stuff, the food. So when it comes to the food, we definitely ask to have a lot of soluble fiber in their diet, right? A lot of omega-3 in their diet, source of fruits and vegetables in their diet, vitamin B, B12, D3, all these deficiencies need to make up. And if we come to the supplements, then again, we have the omega-3 supplements, right? We have phytoesterols supplements. We have one beta-sitosterol, right? And then many of these green tea, green coffee extract, which is there. Then we are taking garlic. Garlic, we can multiple ways we can include, which is a very common supplement at home, which we
Correct.
can then work around. The turmeric, right? So we have so much in the kitchen also, which we can work around. But the only thing where I feel the people are lacking is the regularity. They are not regular with any such practice. They do hear about, they do know about, okay, this thing can help them. But when it comes to the regularity, only one day it happens, or maybe 2 days. And then again back to the normal, right? This is a very practical thing wherein we are open for the learning, but we are very, we don't give it a regular approach. The consistent approach is very missing, which again something I feel that one should prioritize, and one should be disciplined enough to follow few things in routine.
For the women who is having existing heart related condition, so what should she follow? Like if she's having high cholesterol level, then what all
Yes.
parameters? If she's having high blood pressure for that matter, what should she be, careful about? Any food, specific
Yes,
foods
yes.
should she add in her diet?
See, as we just discussing about the foods and the tips, the lifestyle tips about the various like maybe blood pressure or deranged lipid profile. So as I mentioned, like soluble fibers can be included, high omega-3 fatty acids supplements can be included, or the fish, flax seeds, or beans, walnuts, right? All these things can be included. Chia seeds, some good fruits and vegetables for the soluble fiber can be included. Phytosterols can be included. Then we have, it is also shown in the studies like 1 to 2 gram intake for the phytosterols. It decreases the
Wow.
LDL to up to 8 to 10%, which is a significant decrease. And I can see that people are responding to these products, these
Correct.
stuff also. Yeah. And regular consumption of the garlic also makes a lot of difference. And coenzyme Q10 also makes a good difference. For the blood pressure, hibiscus tea has shown very good results. Yeah. And
Right.
low
And
salt
you have made a really wonderful video for us on the DASH diet. So I'll
on
request
the DASH
everyone who
diet.
can go there, can
Yeah.
watch it on our YouTube channel. It was on DASH diet, and what all food should we include for a heart condition, for hypertension specifically, like you said about this beta cytosterol. So beta
Yes.
cytosterol plant sterol in abroad, they are used as a functional food. So they are used in fortifications, and it has
Yeah.
been seen that, like you said, around 1.5 to 2 grams of phytosterol, if you're adding it in our diet, then it is definitely, going to lower our bad cholesterol and LDL
That,
cholesterol. So as a
yes.
functional food, as a food product, if you're adding this supplement in our diet, specifically BestSource Nutrition's plant sterol, beta cytosterol, it's going to do wonders.
Yes, absolutely. Actually, here also one thing to be added, like sometimes we just go for the medication, which is not at all required. It's just the dietary modification and the lifestyle modification which was required. So
Correct.
better to
Correct.
go for these things first and then to start for a statin or something. Because sometimes it is just a deficiency. As you know, like homocysteine levels, we check on the homocysteine levels, right? So if there
Correct.
is a deficiency of B6, B12, B9, it probably
Mhm.
may leading to the rise in homocysteine levels and hence the cholesterol levels, right? And we are working the other way around. Maybe we are just giving the statin, and still it is not coming down. So we need to have a
Correct.
broader aspect now. It's just not that
Yeah.
okay, cholesterol high aaya, so chalo statin lena chalu. It's not this way around. Now we have to broaden our aspect, approach towards it. So we need to look after the every aspect which is missing. Maybe your dietary changes and the lifestyle changes only bring you to the normal. Maybe introducing a omega-3 supplement, or like you said, beta sitosterol, only these things can manage your things maybe. Or maybe having a good lifestyle and the food a good intake, a good healthy regime will again help you out in this. So it's about your approach. First, you need to do this, then this, then this, and you need to find out what was the reason behind it.
Mm-hmm.
Then probably you can work in a better manner rather than just going and switching on to some, statin or something like that. So that really works. So we need to first go step by step in that case.
Yeah, we need to detect like where we
We need
can
to
make a
detect,
change.
where
Yeah,
we can. Yes,
that is really,
yes,
and for that we need a qualified dietitian. We need a qualified healthcare, a person to
professional. Yes.
guide you and a person to guide you on the right, path. That is very, very important. One of the question which we have got is lot of heart attack happening in the young people. What's your take?
Yes, definitely. As I mentioned, like there is a hormonal dysfunction too much going on these days with the younger females as well. So definitely, when there is a hormonal dysfunction, we are at a major or we are at an added risk to the all these cardiovascular things. And added to this, our lifestyle contributes to the same. Again, see, we even the young females, they are under a lot of pressure and stress, and they are not open to share it with anyone. So here again, also I will say that sharing it with a good professional is very important. Sometimes you cannot handle things on your own, right? And you need to be clear about this. If you're not able to handle this on your own, please go for a professional. Even if you need some otherwise help for stress management, you should go for the same. You are looking for a good diet thing, you should go for a good professional dietitian. So never, hesitate yourself from going to a professional for the same. And maybe you need some good support.
Yeah, like
This
you
way
said,
you can avoid it.
hormonal imbalance is very common and people getting the menopause at a very early
Very,
age.
very
So
soon.
that is also something to be concerned about. So one
It's
herb
a
which is
major
really,
concern.
yeah, yeah. So I'd like to add one herb which is really good in increasing the estrogen level, because estrogen
Yes.
is the hormone which guides
Hormone.
our this heart health. It is going to,
Yes,
it's like a shield, this hormone, estrogen. So
absolutely.
after menopause, the estrogen level drops. There is fluctuation in our estrogen level. So here, if you're adding a functional food like there's red
Yes,
clover. So this red clover
yes.
flowers, they are rich in isoflavones. They have phytoestrogen properties. So if we are just adding a tea which is coming from flower, then that is going to be, help. It's really helpful in managing the estrogen level in the female body.
Absolutely
Driving
right.
up
This
body.
red clover has been shown the promising results by the people who are the females who are showing the menopausal symptoms. It has given them a good relief. So yes, red clover is again something which can be added. And this is a very red clover is a very good addition to a diet.
Correct.
And people who are not able to see, again, we are not saying that all the supplements you need to just keep on adding on the supplements. First, I think adding on the supplements also, we can just have two things in mind. First, if you have some kind of a lifestyle where you are not able to match up with the natural things, there is no harm in going for the supplements. Second, even if you are taking the supplements, you have to be regular with them, right?
Correct.
And only supplements doesn't work. It has to be a holistic approach, which is
Yeah.
again very
In
important.
line
It
with
has to be
your,
a holistic approach, right?
yeah.
So we need to have everything together. If you want to work for a particular condition, then you need to have a holistic approach with everything around. That works.
Correct. So one more question which we have got is, so plant steroids are for lifelong. So should they be taking plant steroids for lifelong?
See, I don't see any harm in taking them. You can include them in the natural ways as well.
Yeah, so the
And
thing,
of course,
if you're taking supplement like beta
yes,
cytosterol, if you're taking the supplement, then it is recommended that you take it for 3 months, and after 3 months you do a lipid profile. Before you start the supplement, you do a lipid profile, and you'll come to know like what are your current lipid levels. Based on that, you can decide that how long you should be taking. Specifically, you should be taking for 3 months. Then you should be doing your test. So
yes,
after
yes.
that,
Absolutely. For a supplement,
you
you can
will,
definitely go about like this.
yeah,
Like you can first get
yeah,
it checked, and then again you can get that again checked up.
So I would
Absolutely,
like
absolutely.
to,
For the supplement,
yeah.
it goes well, but for the lifestyle, and I would say that for the, the other approach, if we go about, then certainly you need to take care of yourself lifelong in terms of a good regime and a good lifestyle.
Correct. Agreed on that.
You cannot just switch on and switch off, right? You have to maintain certain good lifestyle.
Agreed, agreed. So, what has been your experience with our Best Source Nutrition? Any home like experience, anything which you want to share about the products?
Yes, Julie. So it's been like long since I have been using your products. So have been like nettle tea or hibiscus tea, from the teas to your products like ashwagandha or omega-3 extracts or milk thistle. So I've been using multiple products, the red clover tea as well. So definitely I've been getting the promising result from my clients, and which is again assisted by a good diet therapy and your lifestyle modifications. It shows good results. I have seen people improving, and for the liver issues also they have seen results in like 2 months or 3 months. So
That's
it does
good.
show up the results. And for the blood pressure also, the hibiscus tea has worked really wonderfully. And for the menopausal symptoms, red clover really works well. So yes, all the symptoms, all the supplements which are meant for these conditions, particular condition, it does work really well.
Yeah, so
Yes.
that's great. It's a pleasure to be having you, and thank you so much for sharing your experience with our Best Source Nutrition's product range.
So basically, all I think we need to say is that we need to really take care of the other activities as well. As I mentioned, the good sleep and the good hydration and the good exercise, at
Correct.
least 45 minutes a day. Active lifestyle is very important. Inculcate easy things, don't go for the difficult patterns or the difficult diets, which I say, like go for something which is sustainable and practical for a long durations, right? As I mentioned, there is no on and off. You have to keep going.
Keep going
And
on.
how can you keep going is with a sustainable pattern, not with something very crash kind of a thing. Any good professional is not going to recommend you a crash diet, right? Finding time for oneself is difficult. So that's
Absolutely.
absolutely right there. That's where I'm focusing all the time, that it's very important for time to, find some good time for yourself. Go for a self date. I always ask my clients to go for a self date, find out a good area in your, a lonely area or wherein you get some peace, and go for a cup of coffee, enjoy that. The self love is very, very important. Anuradha, we need to go for this little self time, which is very important. If you can find out time for everyone else on earth, then definitely you can find time for yourself too. It's all about your approach now.
Absolutely. I agreed with you on this. Yeah, I think we have come to the end of the session and it was lovely. Thank you so much for joining in. Thank you for taking out your time on the weekend on a Saturday and addressing on a very important topic which needs a really lot of lot of attention now here in India, as we are seeing that the statistics, there's increase in the heart related death, increase in the high cholesterol levels in the population. It is being a responsibility for a health for anyone who is working in this area to spread awareness for this heart health. So
Thank you, Julie. Thank you, Julie, for inviting me. It's a pleasure to be here. Thank you.
thank you so much. We'll end this session here.